Oh, I'm sorry. Okay. Does each member certify that to the best of their knowledge, only matters lawfully exempted from open meeting requirements and only such matters related to the stated reasons for going into closed session were heard, discussed, or considered? Members will respond by saying, I so certify.
Thank you. We'll do it by roll call. David, do you so certify?
I so certify.
Thank you. Monica?
I so certify.
Tim?
I so certify.
Megan? I certify. Cora?
I so certify.
And I so certify. Thank you. Do I have a motion to, in response to the appeal, to uphold the finding of no violation of physical abuse in the case of JS versus St. Mary's Home?
Yes. I make a motion to uphold the finding of the LHRC for no violation. However, the committee also wants to make.
That I think.
Oh,
We
that's
can
good. Okay,
Do I have
great.
a second to uphold the LHRC findings? Uphold the LHRC. Thank you. We'll take a vote. David, how do you vote?
Yes, I approve.
Yeah. Monica?
Yes, to uphold the violation of the LHRC. Yes.
Tim?
No.
Megan? Yes. Cora?
Yes.
And I vote to uphold the findings. Motion passes 5-1. Monica, would you like to share your recommendation?
Yes. So we would like to recommend that St. Mary's facility review their existing policies and develop clear, concise protocols to ensure patient care and boundaries, and include training with examples and signage for individuals. So we want to make sure that they review those policies, provide additional training, specifically on patient care and boundaries. In addition to that, making sure that that training is then deciphered down to the individuals, their family members, and any other stakeholders. And then we also recommend that they review and revise abuse and neglect investigation practices to ensure all involved individuals are given the opportunity to participate in the investigation with the aid of their authorized representative, or if that's even applicable, if they have a representative.
Okay, thank you. We will have a vote on those recommendations. So, David, how do you vote? Oh, I'm sorry. Do we have a second?
I vote yes with the recommendations.
David, will you also second that motion, please?
Oh, I can second that. Yes, I'd be glad to.
Thank you. And then you vote yes?
I vote yes. Thanks.
Okay. Thank you so much. And then Monica, how do you
Yes.
vote?
I'm in favor, yes.
Okay, thank you. Tim? Megan?
Yes, in favor.
Thank you. Cora?
Yes.
Thank you, and I am in favor as well. Thank you very much. All right. So now I think we can move on to the facility reports.
Okay, and we are going to make this fast because I know we are definitely running behind. So I'm going to go over my report, and then I think for time's sake, even though this is Tony's first time, there are some changes that he had to make, which was my fault. So he'll go over some of those changes, and you've got the report in your packet, so he'll do his quickly as well. And then Brandon just has to go over violations, and I don't think there were that many, so that should be short as well.
Okay.
So in deference of time, there were some events that were higher, and I think some of that related to the fact that we were short-staffed at the facilities, and this was prior to them. They had closed some of the admissions So I do, but one of the places was Central State. We did find that Central State was also, they had started reporting like medical stuff they didn't need to. So we've gotten them back on track, because with payers, you only have to report if somebody goes to the hospital for an injury, but you don't have to report it if it's based on like somebody has cancer and they're going to the hospital. But they do have to report it if somebody had cancer, went to the hospital, and then passed away while they were there. So all deaths are reported. And we did have a death at Central State for the month of July. We also had a death at Southern Virginia, and we had 2 deaths at Catawba, and all of these were medically related. Some of them had end-of-life cancer issues. So it was not COVID. It was not anything that was related to anything that was neglectful or anything at the facility. The seclusion restraint hours did go up a little bit for some of the facilities. Central State still kind of maintained below their 100 for both seclusion and restraint. They went over, so they're still doing pretty good. And Eastern State went up a little bit with their hours of restraint. Their seclusion hours stayed pretty low, which is still good. MVMHI went up quite a bit, but they're one of the diversion hospitals. So they were taking patients when nobody else was. So they were getting people from all the catchment areas. And typically their numbers are lower. Of course, Southern Virginia didn't have that many, and they since have also stopped admissions because of staffing issues. But even with that, they were able to maintain a lower, they had no seclusion and then just a few hours of restraint. Southwest increased a tiny bit, not too much. And of course, our outlier, Western State, still pretty high, and we're working with them. So I will be meeting with them on a regular basis. Gail did share with me some things they're going to be doing. I did find out about that, calling it a recovery suite. I'm not necessarily in agreement with that. So I will be having a conversation with them about that. But I am working with them and continue to work with them. And as Tanika said, we'll work with them and collaborate with them on the REACH training just to make sure we're still on the same page with what we're doing. Catawba, again, they don't even use seclusion and had very few restraints. CCCA, still an outlier as well. And they only currently have 13 children and adolescents there. So we should see their July numbers drop dramatically. And I'm not sure why their June numbers were so high. So I'm going to start working with them as well, because their numbers should really not be that high. They have to work more on intervention and prevention, and they're really, I'm not sure that's occurring. PGH had an outlier for the month of, for seclusion for the month of June. They're typically not that high. BCBR had a person that was in the ERC for that amount of time. They stood there, and they had Antonio go over that information. And Southeastern, it normally doesn't have that much, but again, they had a couple of people that had to be put in restraint. I'm not going to go over the patient screenings. Everybody was above where they're supposed to be, other than NVMHI. And again, this is their medical staff are okay, but their administrative staff are really short-staffed. So whereas they have staff in the client, in the clinical area, they really are having a hard time with staff in the administrative area. I recently just got NVMHI caught up with core measures, which is the Joint Commission and CMS regulation data, because of that administrative shortage. So any questions? Okay. And like I said, we did have 4 deaths for the month of July, and I'm hoping we don't have any increase. We are seeing an uptick with COVID at facilities. I think we have 5 facilities that have outbreaks right now. So I'm hoping that we don't see an increase in deaths as a result of that. But so far we have not. So I'm hoping that stays that way. Sure. Yes. It will be, yes. Yes. And, right. And we are having, Tony is one of his facilities is Central State, and they do have an outbreak there right now, and it's staff and individuals. So we still, unfortunately, have staff that were not vaccinated. And even with the governor's mandate, it's not saying you have to be vaccinated. So if you choose not to be, you have to be tested. But unfortunately, at Central State, they only had about 40% of their staffing get vaccinated as much as they tried. So some of the facilities had a very high rate, so we're not seeing as much with staff getting infected, but we're still having jail transfers come in, so we're seeing a lot of jail transfers come in with COVID. We can't stop that because that's a mandate that the General Assembly put in. So even when we stopped admissions, we still had to admit the jail transfers and forensics. So that did not stop, which, you know, a lot of people didn't understand that. So that still occurred. But yes, I mean, they will have access to the booster shots just like they did to the vaccines. And hopefully those individuals, I mean, I know I'm going to say sign me up. Hopefully those individuals that have the vaccine already will agree to that third shot. So, and most of them would be up in the about October timeframe because most of the facility staff got vaccinated in February, March. So, and most central office staff didn't get it till like March, April. I got my last one in April. So, we still have till December, but yes, that definitely is gonna occur. We still are giving vaccinations at the facilities when new employees come on board. So we still have access to the vaccine. Brandon, I'm gonna let you go ahead and do your report really quick. You
Sure.
there?
Yep. Let me share my screen really quick.
Mm-hmm. Thank you.
All right. Are you able to see that? All right. So this,
Yeah.
actually, like Mary Claire said, is pretty quick this time. We've gotten now to where I was reporting to you on a time, like a few months at a time. Now we're at where I can do a month at a time. So you'll see the numbers are probably less to you that way as well. But in June 2021, we had 8 violation letters across the 12 facilities. Those were through the abuse neglect investigation process. So those were actually identified by the facility director themselves as a violation. And we used our process to acknowledge that and get the corrective action needed. So you'll see there wasn't really any outliers. Western State had 2, CCCA had 3, Southeastern Virginia Training Center 1, Catawba 1, and Southern Virginia 1. So there weren't any surprise numbers for us in June. That's really all. I know that's a quick report, but there's not a lot to say. If you have questions, though, I should be able to answer those.
Brandon, I have a question. I feel like I might be channeling David here. Is there a possibility to know what the average is year to date with graphs where you're reviewing something monthly, so we know, you know, overall for the year we're looking at 1 per hospital maybe, and then you know, so we know whether the month was higher or lower than the average for the year.
Okay. Yeah, I don't.
Yes, I'll answer
Okay,
for Brandon. Yeah, because Brandon does that work for us. He actually does compile graphs. We've been looking at it this year to compare, to kind of see if there's been any drastic changes subsequent to COVID. So I can actually screenshot that and share that with the committee following this meeting.
Okay, thank you.
That's great.
Is
Thank
that
you.
good, Brandon? Yeah, but he's done all the heavy lifting, so we already have the grasp, but yes, I can share that.
Oh, thank you.
Oh,
Thank you,
any
Brandon.
other questions? Um,
I will say the facilities are doing better with late reporting because we have started the violation letters. So that has, I mean, because Northern Virginia got tagged 1 month like with 10 violation letters. So they are doing much better getting them timely now.
And the violation letters are coming from Office of Human Rights.
Yes.
It's almost like when we do citations in the community, because we don't license our state facilities, we can't issue citations, and that's our way of documenting and citing them for those things. Yep.
Thank you.
Nice. Very good.
Thank you. All right. I know you all are running behind, so I will stop sharing and turn it over.
Thank you very much.
He's going to bring up the 2 reports that
Okay.
one at a time, but Tony will be doing.
May and June.
Thank you, Clee.
May and June.
You can go ahead and start.
All right. This is the facility overview and seclusion report, restraint report for the month of May. I'm also doing the month, for VCBR. I'm also doing for the month of June as well. Seclusion restraint, there were a total of 3 emergency physical restraints for aggression and 1 mechanical restraint. The total duration for the restraints was 2 hours and 2 minutes. Now that was the actual change that's highlighted from the original report that you guys received. During this time period, there were a total of 61 transport restraints. The shortest duration of the restraint was 2 hours, and the longest was 10 hours, 16 minutes. And that was due to the resident having a liver biopsy. Overall time for transport restraints was 289 hours and 3 minutes. Allegations of abuse and neglect. There were a total of 3 abuse and neglect allegations reported. All the allegations were unsubstantiated, and all the allegations were sent to an investigator within 24 hours. Human rights complaints for VCBR in May. There were a total of 12 human rights complaints, and there was 1 substantiated violation under dignity. There were 12 complaints, and all were handled below the director's level. Let's see. There were no policy updates, no facility initiatives enacted during that month. And as you can see, I included all of the current construction for that month of May, just basically demonstrating the entrance, what you see when you go inside after the entrance, visitation rooms, medical exam rooms, dental examination room, and pass through to the medical area from the dental area. Any questions for the month of May?
Are there any questions from the committee?
No, looks good.
All right, thank you. All right, the report for June for VCBR. Also, under seclusion and restraint, there was a total of 10 emergency physical restraints for aggression and 1 mechanical restraint. That was the actual change that we made. The total duration for the restraints was 2 hours and 2 minutes with no injuries. During this time, there were 72 transport restraints. The shortest duration was 1 hour, 8 minutes. The longest duration was 13 hours and 46 minutes due to an overnight sleep study. The overall transport restraints was 305 hours and 55 minutes. And there were no reports of seclusion. Allegations of abuse and neglect. There were a total of 8 abuse and neglect allegations reported during this time period. There was 1 physical allegation and 7 neglect peer-to-peer allegations. All of the allegations were unsubstantiated, and they all were assigned to an investigator within 24 hours. Under the human rights complaints, this is also a change. I'll get to the change. There were a total of 18 human rights complaints received during the month of June. There were 4 substantiated violations of dignity and 1 substantiated violation of assurance of rights. Here's the change. There were 18 complaints handled at the director's level. During the month of June, the policy updates were the facility submitted the annual request to the commissioner for the renewal for the exemptions for June. 1 exemption was removed, and that's 12 VAC 35-115-100B5 due to the facility being able to implement the regulation without exemption. The remaining exemptions for VCBR were unchanged. And again, the construction update, these were photographs of the skylights when you walk through the main entrance. There's a skylight where the buildings all connect to the actual parts from the main building, and basic views of the courtyard that the residents that are in transitional housing, this is what they get to see on a daily basis. They can go out and walk outside and enjoy the sunlight. Also, the hallway to the administrative offices, I took a picture of that because it was so long. Oh my goodness. It felt like walking a half a mile just to go through that building. So that's why I took it like that, to give perspective. But other than that, and there's also a transition room for the residents to look out into the courtyard. So it gives them a nice view. And I took a picture of that right above that. Are there any questions for the month of June?
Very
No,
good.
just confirmation. It looks like the construction is scheduled to be done early November
yes,
still?
Sorry.
No,
No,
I think
later?
when Jason was here, he did stipulate that it wouldn't be till January 2022 that they would actually move in because of COVID. They had some delays.
Yeah.
So he did mention that when he presented at the SHRC meeting. I forgot when that was, but he did mention that in his slide presentation.
Thank you, Tanika. I forgot about it.
No, it's okay. Thank you. That was a great report, and I like the pictures. It's good perspective.
Yeah, Tony actually took them. So
Yeah,
he went
they're
through
really
the
good.
building himself and took them. So
Thank
you very much, and we're done.
you.
Thank you very much.
Thank you.
Okay. We just move on now to our subcommittee report?
Yeah.
Okay. Righty, so Monica, are there any
So I don't have much to report about the bylaws. I know that we were trying to finalize everything, and Jennifer had reached out to Cora and myself to try to assist us with that. My schedule was really crazy, and I don't think we were really able to convene to go over everything. So I told Jennifer that we would, try to get together. So Cora, we will definitely try to reconvene that meeting sometime during the month of September. So we'll have something to report by the next time that we meet. But at this point, we're in a space where we're trying to finalize everything with what we agreed upon at the last meeting. Beyond that, just with respect to HR access, I spoke to Tanika about trying to convene a meeting between myself and her and Carlton Henderson so that we can just kind of get a feel for where we are with trying to move ahead and not get stagnant with HR access. I brought my handy recorder, but we don't have enough time for you all to listen to some more of my voice recording.
We're going to put it on the agenda for the next meeting, so we
Okay.
have time.
Well, I have plenty of voice recordings on human rights, okay? But for those of you who may not be familiar, our idea is that we're really trying to make sure that there's a clear understanding of human rights by all. And so that's what the HR Access project is all about. In addition to that, though, I was telling Tanika that I do want to promote some other things that were not as prominent as the voice recordings and the information we want to put on the website. I was telling her that I feel like we need to have like signage in all of our facilities and all of our programs. I mean, the same way we want people to have the rights poster up when we go in these facilities, I feel like even in here, we should have a sign that says, we say individual, we don't say client, we don't say resident, we don't say, we want to make sure that all the language across everything that represents the Office of Human Rights and DBACS has the right language in it. So that's one thing I want to do. I want to, try to see if, as we continue to roll out HR Access, if we can maybe create, some support groups amongst authorized representatives and family members and individuals to just kind of poll them to see, what questions do you have about human rights, and maybe corral and strengthen that body of individuals who support the individuals that we're trying to advocate and service. So there are some other ideas that I do want to entertain when we meet. So in our next meeting, I hope to kind of not only just bring my recordings back, but also bring some ideas of where we will be for the next 6 months with HR Access. So,
Thanks very much.
all right, thank you.
Righty. Then the next topic is the policy subcommittee, and it's
We don't-
David and Mary
there's nothing-
Claire.
Yeah, there's nothing much we're working on right now, but I got the email yesterday about the look at attendance and the use of meetings and using them online, but I wasn't able to go to the link. The link didn't seem to work. I tried to.
Okay. Were you able to
Tom.
open it, Monica? No? Okay. Okay, I was.
wasn't
I'll try
able.
to figure out what happened with that. So they're talking about a resource that Karen gave us. And
Right.
in early September, we should also actually have a draft template of a policy that another state agency is using. And I'm always of the mind that when we can mirror another agency, it just makes it easier for folks that are trying to participate with us, so they know how to engage in the public setting anyway. So we'll probably be able to borrow that. And I would think, David, your committee would want to write that into a policy for this committee. And then Cora and Monica, you all might want to adopt some of that language in our bylaws.
Okay,
So I'll make sure that you get that information. I'm sorry, the link didn't work.
yeah.
David,
Oh,
once
that's
I
okay.
got it, so you and I can set up a meeting to start working on that.
That'd be great. That'd be great.
Okay.
Appreciate it. Thank you.
Thank you all. Looks like maybe there is no officer subcommittee, no members.
I know, right?
We should have an officer assigned to that, maybe.
We probably should
We'll
think about that.
Yeah.
And then,
And then the work plan or membership committee. So and I did not have any discussions about new members this last month, but I think certainly with the 2 vacancies, we need to put that at the forefront so we get back up to the 9. Should someone else take over my role on the subcommittee? Okay,
Yeah.
great. So Megan, I don't want to put you on the spot, but you're not currently assigned to another committee, I don't think. So would you be all right being on the recruitment? Okay, great. Membership subcommittee. We'll make that change and we'll look to, as far as I know, there weren't any applications in the last month. I think just the meeting before last, I had reached out to all of the people that had historically applied and were on the list, and I didn't hear back from anyone. So, that was not fruitful. So
I know that we also did kind of a push at the manager level, and we came back dry as well. And I don't know if that's just a sign of the times, folks not necessarily understanding that they have the opportunity to meet virtually if certain things apply. But I do know that some of our LHRC members have expressed concern and almost fear about the requirement to meet in person. And so I don't know if that's impacting folks wanting to agree to be SHRC members. And then I know, Julie, you had some ideas about trying to make sure that we are incorporating all of the diversity, equity, inclusion initiatives, even to the way that we recruit for this committee. And so more conversations are going to be had about that.
yeah, thank you for bringing that up. So I don't have all the answers, but I want us to be very well represented and ensure that we're hearing all the voices, certainly that we're representing on the committee. So more to come, and if you have any ideas, please let me know or let Tanika know. Righty, so that is our committee. So then we have LHRC Business, and Pasco has been extremely patient for the last 4 hours.
And Pascal's
Thank you,
chomping
Ann.
at the bit to get out of here and be fast.
know.
Somebody in my family scheduled something at 2 o'clock, and there's no phone number for me to call in. I texted you, Tanika. But that's okay. I'm gonna be super fast because I think it's all laid out in front of you. I don't know how slow you want me to go or how fast I can go. But if you start on page 68, you have the resignation letter for
And I will
Renee.
tell you, we're not saying names,
Oh.
right? We're not saying names because we're going to stay in open session. So I just want to remind you about that.
Okay, I didn't know that. I'm sorry. Thank you.
Okay, I thought I would catch you.
Thank you. No, perfect. So if you start on page 68, you'll see the resignation letter for a member from the Northwestern area LHRC. They decided not to renew their second term. There's a copy of the resignation letter on page 68 and a copy of the roster on page 69. For the facility, the Central State LHRC, there's a reappointment. This is the second term. It's on page 71. That's the letter requesting the reappointment. There's a copy of the roster with that individual's continued membership on page 72 and a copy of that individual's application on 73. Region 1 Northwest Area LHRC reappointment, again, of a current member on page 76. Copy of the roster with the individual's continued membership on page 77 and a copy of the individual's application on 78. Region 2, my region, there's a copy of a letter recommending an individual to the Northern Virginia Hospital LHRC. This is on page 80. This is an individual who was on the Prince William County, and this individual completed their second term, and we were able to ask this individual if they wanted to continue, and they were interested, so they're going to go on another committee. So this page 81 is a copy of the roster for the committee that this individual is looking to go on, a copy of this individual's new application, and a copy of the individual candidate interview sheets on page 84 through 87. For Region 4 Metropolitan LHRC, there's a reappointment letter starting on page 89. There's a copy of the roster. It does not include this individual because technically, I guess it's a new appointment because their appointment ended on 6/30. And then there's a copy of their reapplication on page 91. Region 5, Health Planning, Region 5 LHRC, there's a reappointment letter on page 93. Copy of the roster for continued membership on page 94 and 95, and a copy of their reapplication on page 96. Region 5 Southeastern Regional LHRC, there's a copy of the appointment letter on page 99, copy of the roster with this individual's continued membership on page 100, copy of the reapplication on 102. Also Region 5, also Southeastern, there is another reappointment, page 104. The roster is previously on page 100, and the copy of the individual's application on page 105. Again, Region 5, Williamsville Regional LHRC, there's a copy of a reappointment, page 108, copy of the roster with that individual's continued membership on 109, and copy of the reapplication on page 111.
Thank you, Anne.
Do you need anything else from me?
I don't think so, Anne. Thank you very much.
Thank you.
I feel like that really was lightning fast. I hope that's all right.
It was good.
All right, I'm leaving the meeting.
Great.
You don't have any questions for me unless you need me to do something with these?
You're great. Thank you.
Thank you.
Thank you very
I was
much. I
talking and I
appreciate
didn't
it.
have my speaker on. Thank you.
Right, is there anything else that we need to discuss then? I guess next meeting.
Vote on.
Oh, okay.
Yeah.
We need
So I'll
to-
make a motion that we accept all the resignation letter, the appointments and the reappointments as provided by the regional advocate.
Do I have a second?
I second that motion.
Let's vote. All right, David, how do you vote?
I vote yes, I accept all of them.
Thank you, Monica.
All in favor, yes.
Thank you, Tim.
Yes?
Megan? Yes. Cora?
Yes.
Thank you, and I accept as well.
Just a reminder about the LHRC liaison report. So if you all do want to participate virtually or in person, you're still able to do that, and there's an actual form to fill out for that.
Okay.
That's what that means on the agenda.
Okay.
And then, yeah, Julie, I think the last thing is just to talk about where we want our next meeting to be and if there are any speakers we need to invite. Yes, but there's nothing else we have to vote on. It's no problem.
Oh.
No problem.
Right, are there any thoughts? I'm really sorry, I'll try to keep this on track better next time.
We had a lot, and some of that is me doing a better job of organizing it on the agenda, so it's good.
Any thoughts on where we should have the meeting next month?
I think
Is
there were
any
conversations
area that
about
we
having
haven't gone to recently, or in the last, last couple of years that has been neglected?
It's a good question. I don't know. I don't recall.
I don't know, before COVID, we kind of moved our way around and we had, went to all of them, so I don't think there's only one place that's been neglected.
I don't know if you can hear.
But I think we've been pretty good about finding every place. We usually do Richmond twice a year, 3 times a year, because it's more centrally located. But we've done Northern Virginia, Western Virginia. I think maybe this might be.
I don't know that we've been to CCCA in a while. Right.
Yeah.
My next statement was going to be, I really don't know that we want to go anywhere, if I'm being honest, just
Yeah.
because of the Delta variant and just lots of things. And we may want to take the opportunity to make our September meeting the one that we make it where all members are present and we have no members virtually participating, because we have to do that for FOIA.
Before potentially
Yeah.
things get worse. Yeah.
Right, because like, what if it snows or something? I love the idea that folks can participate virtually, so we don't want to exclude people from that. But September might be enough time for folks to make plans to try to come, and then they won't have to worry about snow, hopefully.
Okay.
What about Eastern State in Williamsburg? Would that be somewhere that we could all
You
get
want to just
to?
stay, what about then we just stay in Richmond? Just stay in Richmond now in the September meeting?
Yeah, separate from, yeah. Their conference room's small, but they do have a training room, you think? Okay.
They have, the auditorium.
Oh, that other building, yeah.
And then they have been doing a lot of stuff in the gym, so we might be able to talk with Brandy, but they're going through a lot of stuff right now too, so I just, and they do have an outbreak right now.
Mhm.
of COVID.
Okay, well,
I think we just stay here
Mm-hmm.
for the next one in September. Centrally located, we don't have to worry about a lot of COVID stuff going on. And just for now to play it safe, but we can still meet and make the requirements.
And we can get parking, so
Yeah.
it's parking, I mean, we can do what we did today, start getting better parking.
Okay.
So I would recommend we meet here in September.
yeah.
I'm in agreement with that. Is that, Cora and David, are you all okay with that as well?
That's fine, yeah. What date are you looking at?
It's
September
September 30th.
It's what?
All of that.
Sorry.
No, it's okay.
So it'll be September 30th, and the meeting will be here at
Central office.
central office.
So we will work on getting hotel rooms for folks that need that and parking. Clee will be in touch with you about that.
Would be an omelet bar?
All right. Thank you all. With that, I'll adjourn the meeting.
Thank you.
Thank you.
Very good discussion,
Bye.
everybody. Take care.
Stay safe.
You know,
Thank
Great
you.
it does
discussion.
work off the
Bye, y'all.
microphone.
Bye, everyone. Have a great day.
Thank you.
Hello.
Bye, everyone.